Minister for Community Services.
Deputy Speaker, I recently attended a seminar hosted by Sexual Health Quarters celebrating the success of Safe to Tell, a groundbreaking program screening clients in clinical and counselling settings for intimate partner violence and reproductive coercion and abuse. This government has a very proud record of recognising the freedom and autonomy of people to make decisions around their reproductive rights. We passed laws providing safe access zones around termination clinics and passed laws which decriminalised abortion. Reproductive coercion is a form of intimate partner violence whereby someone's reproductive health is controlled by their partner and can include contraceptives being sabotaged so that they don't work, threats or use of physical violence if a contraceptive is requested, emotional blackmail around sex, pregnancy and termination, and partners insisting to attend all relevant appointments with the intent to control and monitor their partner. In 2018, Sexual Health Quarters developed a program which consists of a screening tool and training modules for staff to align with our Path to Safety strategy. In particular, the strategy's focus area to build specialist and mainstream workforce capacity to identify and respond to family and domestic violence. The goal of the project is to empower healthcare workers to recognise, respond compassionately and refer people experiencing reproductive coercion to appropriate support services. Sexual Health Quarters, who've been delivering services for over 50 years, are just one example of the community health organisations who are invaluable in our response to family and domestic violence, as they are often the first point of contact for victim survivors seeking help. These organisations not only offer safe, trauma-informed and culturally appropriate services, but also play a critical role in preventing violence through education and early intervention. I want to congratulate Sexual Health Quarters and thank their CEO, Deborah Barnes, and her team for their hard work on this innovative program and want to highlight it as an example of how we can work collaboratively across sectors to identify and address family and domestic violence. This initiative complements the Cook Labor Government's work to address coercive control, including our $5 million public awareness education campaign, Coercion Hurts, to raise awareness about coercive control. We've also passed changes to the definition of family and domestic violence in the Restraining Orders Act to better recognise the patterned nature of coercive control, and undertaking a review of the Common Risk Assessment and Risk Management Framework to ensure it includes coercive control. Again, I would very much like to congratulate Sexual Health Quarters on their successful project and their commitment to addressing family and domestic violence.
Thank you, Minister.